After Ryan's arrival, Amy embraced the challenges of motherhood, choosing to work from home to be closer to her beautiful baby boy. The initial months mirrored what Amy's parents had communicated to her: countless diaper changes, late-night awakenings, and the scarcity of personal time. However, as time passed and Ryan approached the 3 to 6 month mark, Amy began to observe behaviors and reactions that set him apart from her friends as newborns. Ryan is yet to learn how to crawl, and he can't sit up yet. He also becomes incredibly startled when the TV turns on or when someone calls Amy's phone. Most concerning of all, Ryan is yet to start eating any solid foods and has difficulty swallowing anything. Despite the reassurances from well-meaning family and friends, Amy couldn't shake her nagging suspicion that something might be amiss with their precious son. The anxiety that had been building within her finally reached its breaking point, prompting her to turn to a family friend, a medical professional who had seen his fair share of health issues. Immediately after hearing the symptoms, the family friend refers Amy to an ophthalmologist, who upon conducting an eye exam on Ryan, found cherry red spots surrounding the macula of the eye, an observable precursor for the genetic Tay Sachs disease. The heart-wrenching diagnosis was later confirmed by a pediatric neurologist, and Amy was devastated, as any mother would be. The reality that her Ryan would face a gradual decline in both physical and mental health throughout his childhood was unbearable. Yet, throughout the early years of Ryan's life, Amy and her family clung to their unwavering love and determination. Upon further inquiry and research, Amy and her family come to terms with the difficult nature of Tay Sachs and would now do their absolute best to cherish the time that they have left with Ryan, as well as raise awareness for such an intricate and complex disease.
Now that we have seen what it is like having a child with Tay Sachs, let's get to understanding this disease a little better. Tay Sachs disease is caused by the buildup of a fatty substance called GM2 gangliosides in the central nervous system, which leads to swelling and destruction of brain and spinal nerve cells. This is caused by mutation on the hexa gene of chromosome 15. Think of a mutation like a spelling error. Just like how a word with a typo no longer has the same meaning, genes that undergo mutation can no longer carry out its function. This causes a deficiency of an enzyme that is responsible for breaking down GM2 ganglioside. This enzyme is called beta-hexasaminidase A. Tay Sachs disease is inherited and follows an autosomal recessive pattern, so an individual with this disease must inherit 2 copies of the mutant hexa gene, one from each parent. There are 3 forms of Tay Sachs disease: infantile, juvenile, and late onset or adult. The most common form and the one we are focusing on is infantile. This is where symptoms arise soon after birth at 3 to 6 months, leading to death and early childhood. The lifespan of infantile Tay Sachs is 4 to 5 years, as there is currently no cure for this disease. Diagnosis of Tay Sachs disease usually follows the onset of physical symptoms, including vision and hearing loss, muscle weakness, overly startled, muscle twitches, and the inability to reach motor milestones such as crawling and standing. Children with Tay Sachs may also have cherry red spots in the eye. Once symptoms appear, diagnosis can be confirmed through blood tests as well as with genetic testing. Tay Sachs disease is incredibly rare in the general population. With that being said, studies have found that the mutation responsible is most prevalent in Eastern and Central European Jewish populations, specifically people of the Ashkenazi Jewish heritage. For the general population, the gene mutation is present in 1 in 250 people, whereas for the Jew community in the US, the mutation is present in 1 in 29 people.
How can families determine if their future babies may be at risk for Tay Sachs? When parents from at-risk groups are planning to have a baby, they should go for genetic counseling. A specialist will conduct a blood test to determine if their children may potentially have Tay Sachs. There are also tests that can be performed during pregnancy to diagnose. Amniocentesis can be performed between 15 and 40 weeks of pregnancy. It involves taking a sample of the amniotic fluid, which is the fluid surrounding the fetus. Chorionic villus sampling is another test and can be performed between 10 and 13 weeks of pregnancy. A sample of the placenta is taken for testing. This test has higher risks than amniocentesis, however, can be performed earlier in the pregnancy. Let's take a look at how Tay Sachs causes neuron death, leading to the symptoms seen in affected children. As we discussed, the hexagene is the gene that becomes problematic in Tay Sachs. In a normal cell, this gene would encode for an enzyme called beta-hexosaminidase A. In our neurons, this enzyme is located in little structures called lysosomes. Think of lysosomes as little garbage bins, and the enzyme as the shredder that breaks up the garbage as it enters the lysosome. When this enzyme is functional, then a certain fatty substance in the cell membrane called GM2 ganglioside is broken down. In the end, we have healthy neurons. But what happens in Tay Sachs? The hexagene is mutated, which means it does not make a functional enzyme. Because of this, our garbage bags, which we call lysosomes, do not have functional shredders, and so the fatty substance called GM2 ganglioside begins to accumulate in neurons. In the end, these neurons become dysfunctional and die off, leading to the problems seen in affected children. What are scientists working on to develop future treatments for Tay Sachs? So, there is no current cure for Tay Sachs, but there are studies that are working on developing a possible treatment called gene therapy. Gene therapy is a broad term, and in our case it means that the hexagene, which is not working in neurons, would be injected into patients. This means that neurons would be able to make the enzyme which breaks down the fatty substance called GM2 ganglioside. This would mean that neurons would be working and would result in a reduction or absence of symptoms. This is what we have to look forward to in the future.